Hi everyone, my name is Brooklyn. I'll be introducing our presentation today. We'll be exploring the historical impacts and present-day challenges of tuberculosis treatment in disadvantaged communities. Let's talk about what's in the news. The news article we'll be discussing is called Tuberculosis Rising After COVID-19 Pandemic Redirected Services, say Canadian health officials. It highlights the recent rise in tuberculosis cases in Canada and attributes it to the shift in healthcare efforts and resources away from tuberculosis case management and toward the COVID-19 pandemic instead. Tuberculosis is a disease caused by the Mycobacterium tuberculosis pathogen, spread through air by droplet transmission. Historically, tuberculosis has been affecting Inuit and First Nations communities. Specifically, evidence has shown that cases are 300 times higher in these populations compared to Canadian-born and non-Indigenous people. In 2022, there was a 10 to 12% rise in the number of tuberculosis deaths, and the question is why? From the 1940s to the 1960s, Indigenous people with tuberculosis were forcibly taken from their homes to tuberculosis hospitals called sanatoriums, where they endured physical and psychological abuse for months and even years. This topic is relevant to nursing, considering the fact that they are the frontline workers caring for these populations and contribute majorly to getting this crisis under control. As stated in the Matakonge article, the quality, efficiency, and equity of care is dependent on the availability of skilled and competent healthcare professionals. With that said, social and historical context should influence approach to care. One of the articles we selected emphasizes how disproportionately prevalent tuberculosis is amongst particular communities in contrast with others, and why that may be. In relation to that, we will be exploring iatrogenic factors, which are health-denying and disease-fostering medical interventions, while the second article expands on the impact tuberculosis has on nursing care in rural, marginalized areas in South Africa, which, similar to Canada, hold a racist history, and what kind of solutions and precautions can be implemented to address it, which Angelica will explain next.
Thank you, Brooklyn. So the article that I'm going to talk about first is Caring for Tuberculosis Patients and Understanding the Plight of Nurses at a Regional Hospital in Limpopo Province, South Africa. So the study explores the nurses' challenges, problems, views, and support needs, and how caring for TB patients affects their physical and mental health. The study uses a non-probability purposive sampling method to select 6 nurses who have more than 5 years of experience in caring for TB patients at the hospital. The data collection method is in-depth individual interviews which are guided by an interviewer with open-ended questions. Interviews are audio recorded and transcribed verbatim. The study also finds 6 major themes from the data, which is the challenges of the working environment, problems impacting on the quality of nursing care, fear, anxiety, and stress, and the risk of contracting infection, and nurses' perception towards patients, support structure available in the hospital, and support needs for the nurses. The study also discusses the implications of these themes for nursing practice, education, research, and policy, and the study also acknowledged the limitations of the study and suggests recommendations for future research, which Trisha will discuss later. The study concludes that caring for TB patients is a complex and demanding task that requires adequate resources, training, support, and protection for the nurses. The study also highlights the needs to address the stigma and discrimination that the TB patients face in the society. The second article talks about how Inuit people who were diagnosed with TB resisted Canadian government's program to treat them in segregated Indian hospitals between the 1936 and 1969. The main source of evidence for the article is a collection of conducted interviews with Inuit elders who had experienced Indian hospital treatments or had relatives who did, which were addressed to government officials and translated by government employees. So the content of the letters revealed the emotional distress and physical suffering that Inuit people endured as a result of Indian hospital treatment. Multiple writers expressed their feelings of loneliness, fear, anger, sadness, and despair. It also describes the poor living conditions, inadequate food, harsh discipline, cultural alienation, and medical neglect that Inuit people face in Indian hospitals. The letters also show how Inuit people refused to comply with the rules and regulations of Indian hospitals, such as wearing hospital clothes, eating hospital food, or even staying in bed. They thought that the Indian hospital treatment was a way of making Inuit people sick or hurt by using medical Western methods, which made the Inuit people negotiate with government officials to return home sooner, receive visits from their relatives, or to access traditional medicine rather than in faraway places where they feel isolated, lonely, and scared. So the main contribution of the article is that it provides a novel perspective on the history and politics of TB treatment in Canada from an Inuit point of view. Article challenges the dominant narrative that portrays Indian hospital treatment as a humanitarian and scientific endeavor that saved Inuit lives from a deadly disease. Shows how the Inuit people's action to oppose and change Indian hospital treatment were a way of fighting and transforming the colonial systems and relations that oppressed them, and how Inuit people's actions expressed their sovereignty and dignity as Indigenous peoples, meaning that they had the right and power to govern themselves and their hands, and that they had the respect and the value as human beings.
The article appears to use a critical social framework. This theory highlights constraints on human freedom. In this case, the Inuit and First Nation communities are lacking support. The article argues that TB is neglected, disease that affects millions of people, especially Indigenous communities and other low to middle income countries, and that more funding and commitment are needed to end the TB epidemic, which has been a trend throughout Canadian history. As Brooklyn briefly mentioned, the marginalization of Indigenous people is long-standing. In this article, CBC draws into the historical legacy of tuberculosis among Indigenous communities, revealing how this painful history still affects their confidence in healthcare today, which exposes the underlying economic, social, and political factors that perpetuate the issue. This theory enhances the discussion by forcing the readers to look at the bigger picture instead of surface level. Framework is that providing a historical and structural analysis of the social and economic factors that contribute to the spread and persistence of TB, such as poverty, inequality, colonialism, migration, and health system weakness, highlighting power relations and interests that shape global response to TB, such as pharma companies, government, civil society, and affected disadvantaged communities. It can help in evaluating the effectiveness of public health policies and interventions during COVID-19 pandemic, such as resource reallocation, lockdowns, and vaccination campaigns. The limits would be that being too abstract or theoretical for some audiences, like the general public who might prefer more concrete and practical solutions, being too idealistic and optimistic for some realities such as complex challenges of TB, the limited resources and capacities available for TB, and competing priorities and agendas in global health. And lastly, depending on the specific framework, it may overlook some critical factors contributing to the rise in TB cases. For example, it might not account for socioeconomic disparities, immigration patterns, or healthcare system capacity.
In terms of cultural considerations, early medical literature depicted Indigenous people as diseased and a threat to white settler society. Tuberculosis was the leading cause of death in Canada in 1867, and it took 73 years for Indigenous people to finally receive some kind of treatment for the disease because they were purposely excluded. And when they did, it was the implementation of sanatoriums, which were severely unethical and rooted in abuse and racism, and ultimately exacerbated patient conditions, which resulted in deep distrust in the healthcare system presently. Despite the apology issued by Justin Trudeau in 2019, where he describes the Canadian government's treatment of Indigenous people during that period as misguided and colonial, these communities are still currently lacking adequate healthcare resources, hence why they are still plagued with this disease decades later.
Addressing the fear, anxiety, and risk of TB infection among nurses requires a combination of education, infection control measures, psychological support, and proactive risk management strategies. Additional issues that nurses may experience is a lack of budget and not having enough resources readily available to them nearby. Hospitals should be equipped with a negative air pressure rooms with proper ventilation and N95 masks. Respect Indigenous healing practices in order to build trust between nurses and Indigenous populations. Engage with Indigenous communities through culturally sensitive health education programs. These programs can emphasize the importance of early diagnosis and potential benefits of integrating practices with Western medicine for TB management. By approaching care with cultural competence, trust building, and sensitivity to the fear of stigmatization, nurses can help Indigenous individuals feel more comfortable disclosing family members' health conditions, seek early diagnosis and treatment, and and reduce the impact of TB within their communities. Develop specialized TB training programs for nurses working in indigenous communities with a high prevalence of TB. This program should cover the various stages of TB, including latent and active TB, and emphasize the importance of tailored treatment regimens for each stage.